is Emmanuelson. I am the first floor member of the Barbados Youth Development Council, and with me here in studio, I have Miss Shante Ward, and we're going to be having conversations around everything menstrual health. Hello, everybody. Good evening, and welcome to this talk. With me in studio is Miss Shante Warden, and we're going to be having a conversation surrounding everything menstrual health. And today we're going to be discussing one of those topics that you don't really talk about, endometriosis. First, I'll have Miss Warden introduce herself, and then we're going to get right into the conversation.
Good afternoon, everyone. Thank you for that lovely introduction, Iman. Now, my name is Shante Warden. I'm the Vice President of the Barbados Association of Endometriosis and PCOS, and we are a registered charitable organization here in Barbados. And we aim to bring relevant information about conditions such as endometriosis, PCOS, and other debilitating gynecological issues that women go through to the Barbadian society. And we also try to support persons who may be in need of help.
Lovely, lovely. Shantae for a moment. Shantae, are you still there?
Yes, I'm here.
Okay, now going into the conversation. Miss Warden, could you let me know? Is it me? Are you still there?
Yes, I'm here, Iman.
Okay, because I muted my mic because I was before he played the video.
You can see me?
Yeah, I can see you now.
Okay, thank Nicholas is saying, Nikhil is saying we should reschedule.
Hello, everyone. Good evening. My name is Iman Wilson. I am the first floor member of the Barbados Youth Development Council. Tonight, we are going to be in conversation with Miss Shante Warden from the Barbados Endometriosis Association, and we're going to be talking everything period health, menstrual health, and endometriosis. Miss Warden, you can introduce yourself and tell us a bit about your organization, and let's get the conversation started.
Good afternoon, everyone. Thank you so much for that introduction, Iman. My name is Shante Warden, as Miss Iman Wilson said, and I am the Vice President of the Barbados Association of Endometriosis and PCOS. Now, we're a registered charitable organization right here in Barbados, and we aim to bring relevant information about conditions such as endometriosis, PCOS, and other similar debilitating gynecological issues that women may go through. And we also try to support women with these conditions. So whether that be monetary, maybe just somebody have a community that you may be able to share your story with. We are here for persons who go through these things on a daily basis.
Okay, that's very interesting. And for those of you that are watching, you can go and visit them. I believe they have a Instagram page. Can you let us know where persons can find you?
Yes, so we're on Instagram, we're on Facebook, and we also have a Gmail, and we also have a website. So when you go on Instagram, you type in Endo and PCOSBB, and we should come up. And also our Gmail is Endo Association of BDOS at gmail.com.
Great. Now let's get into the conversation of what we're here to talk about tonight. And tonight we're going to be talking about endometriosis. Can you give our viewers like a small definition of what endometriosis really is?
Yeah, sure, that's no problem. Now, this is a very long term, so we tend to say endo for short because some persons get a bit tight tongue trying to say endometriosis. Now, this is a chronic progressive disease that women go through, and basically what happens is that tissue that behaves similar to the tissue that is in your endometrium, which is the lining of your uterus, we call it the endometrium, the tissue behaves similar to that. So what it does on a monthly basis, it builds up, it breaks down, and that is what you see coming out as the blood, right? So imagine that tissue now, or tissue similar to that, let's say that, because that's what it is. It's similar to that tissue that grows inside of your uterus, that goes outside of your uterus. So it can go on places like your fallopian tubes, places like your bladder, your bowel, and cause issues. So the same thing happens. It builds up, it breaks down, and blood is in places that it shouldn't be.
Okay. Now could you tell us like what are some of the physical signs associated with endometriosis? I know you talk about internal signs or some of the internal issues. Could you let us know of some of the physical signs associated with it?
Okay, so when persons have endometriosis, what happens is they tend to usually have very painful periods. Um, this is what we would call secondary dysmenorrhea, and this is something that occurs, when you have a reproductive issue, a disorder such as endo or PCOS. Now, usually there are two types. There's primary dysmenorrhea and there is secondary dysmenorrhea. So primary dysmenorrhea is what some persons usually get, which is the pain associated with your periods. That's what dysmenorrhea is. Now you're gonna have some level of pain when you're having your period, and this is normally because of the prostaglandins, which is a hormone in your body. This happens, or this hormone increases when you have your menstrual cycle. Now, as your menstrual cycle goes on, so some persons may have a cycle of 2 to 5 days, some persons may have a cycle of 2 to 7 days. And as that time goes on, those prostaglandins in the body decrease and that pain decreases. Now, if you have a condition such as endometriosis or PCOS or any of those other conditions that women go through, you don't have that pain decrease as your period gets on with its time, right? Persons also experience heavy bleeding, right? So having to change their pads, let's say every 2 hours, pads or tampons. So every 2 hours or less, persons, when they have to change those sanitary products or sanitary napkins so often, that is also a sign. Persons have low back pain. persons tend to have back pain when they have endometriosis. They also may have pain with intercourse. And this is not for every person, everybody varies, right? This is not a one size fit all situation. So because I have pain and back pain, it may not necessarily be endometriosis. So this is where we then say, you need to go and you need to have a check from a OBGYN, right?
Okay. Would you then say that endometriosis is a genetically acquired something, or is something that a person can acquire through lifestyle um, changes, perhaps?
Yes. So I'm not a doctor, but this is what we always tell persons when we speak to persons on issues such as this. We like to say, okay, we give you the facts and you go and you speak to a professional, right? A medical professional, preferably a gynecologist. Now, what studies have shown and what doctors would have realized is that conditions such as endometriosis tend to run in families. So, a person, so let's say I have a child, I have endo. My child may not necessarily have endo, but maybe her child or his child may have endometriosis somewhere along the line, right? So they do think that there is some type of genetic link between women in families having endometriosis.
Okay, so it could be passed down either paternally or maternally, correct? Or is
Yes.
it passed down maternally mostly or paternally mostly? There is no
And there's
specific
there's
link
no
as to where it can pass down from.
No, no, there's no specific link, but we know that it runs in families. So you may find aunts and nieces having it. You may find mothers and daughters having it. You may find a grandmother and a granddaughter having it. So yes, there's that link, but we can't say if it's for sure through the maternal or if it's through the paternal. My belief is that maybe it's probably both, right? Because genetics, as we know, are in everybody, and they they can vary, right? And conditions can pass and skip persons in different generations.
Definitely, definitely. Would you then say that for a person who has endo, that lifestyle changes will be able to assist them in probably combating some of their symptoms, like you've mentioned before, the high level of period pains? Would you then say that a change in lifestyle could assist a person like that?
Okay, so in terms of this question, this is a very good question that you've asked. Now, as I said, this is not a condition that is a one size fit all, right? So which means that every treatment is not going to work for every single woman that has it. Now, there's a diet, and they say, okay, you're not supposed to eat gluten, you're not supposed to use dairy, red meat, sugars, caffeine, alcohol, all of these different things. Now, I would have went through that lifestyle change in my eating habits, because I myself have endometriosis, and it didn't work for me, right? It made my symptoms worse. Um, there are other women who may go on that same type of diet and try to cut out all the things that are necessary, and their pain decreases, right? So it depends on what works for you. Many times women have to go through different types of treatments to finally find that one that suits them, that works with their body. So I would say lifestyle changes can work for some persons, but for others it may not work.
Okay, so then you would say there's no specific treatment that you would suggest for any person with endo, because it is something that I can that let's say that you're using one particular treatment is working great for you. However, for me, that it might vary because my body may not tolerate it then.
Exactly. Now, in terms of treatment, there are different things that can be done for persons living with endometriosis. Now, the first one is pain medications. So, a doctor may prescribe certain type of pain medication for a person living with endo. Let's say that doesn't work, and the doctor said, "Okay, we're gonna do hormonal treatments because." What happens is that the hormones in your body, what they think happens is that that helps to increase the amount of tissue that grows in your body. So if we can keep those hormones at a certain level, then the chances are of you, getting worse, it lessens, right? Um, so hormonal treatments, pain medication, and then there's surgery. There's the option of surgery. Everybody does not want to have surgery because surgery is a very scary process for many persons, but there's that laparoscopic surgery that persons may have to undergo to first thing first check to see if what they're really experiencing is endometriosis, and then the surgeon would then take out the deposits wherever they may be. They may have to do maybe some reconstruction of some organs, because endo can destroy organs in our bodies. So it can destroy your bowel, your bladder, fallopian tubes, ovaries. Some persons may even have to lose certain organs, right? So, as I said, there are those different treatments, or I would say help, you know, for endometriosis, but everybody varies.
Okay, you kind of like just answered my question of whether endometriosis can potentially affect fertility in women, and like hearing your answer as it relates to like removal of some organs and stuff like that, you definitely answered the question. But for like but for persons who are on treatment, let's say they're on this particular type of medication and it's not working for them, what then can you recommend, or would you say doctors would then recommend for a person who is on treatment for a particular symptom, but instead of the medication helping to ease the problem, it's either increasing the problem or the problem still remains the same?
Okay, so what I would say to that, and I can speak from my own personal experience, if a treatment isn't working, once your doctor really understands the condition, they will try different options. So there are different pain medications. Everybody's body is not going to react to each and every pain medication. So there are persons who can be taking things from Panadols straight up to morphine, right? When they have conditions such as these. And then there's the whole situation where your body becomes accustomed, right? So in my case, my body became very accustomed to the more simple medications. So then I went all the way up to morphine, and then there's nothing after that. So then you have to find another route, and that route may be surgery, because if you're not getting that relief from the pain medication, you're not getting the relief from the hormonal tablets, then something needs to be done, right? You need to go in then and take out those deposits that are causing the issue, and then from there the doctor should put you on a treatment after that.
Okay, thank you so much, Miss Warden. Right now, we are going to head to a break. For those of you watching us live now on YouTube, on Twitter or Instagram, you can remember to join the conversation by posting your questions on Twitter or answering directly in the YouTube on the YouTube channel. See you guys in 5 minutes. good night, and welcome back, viewers. Tonight we are having the discussion surrounding everything menstrual health, and with me I have Miss Shantae Warden from the Barbados Association of Endometriosis. And Miss Warden, we can continue the conversation. For those of you joining us live on YouTube, remember to drop any questions you may have on our YouTube channel. And those of you watching us live on Twitter, you can join the conversation by hashtagging and joining the conversation everything endo. Miss Warden previously would have stated that through the through the process of endomet through the process of where the doctors would do the scans and stuff like that, could you now tell us what exactly are the doctors looking for when they're doing the scans?
Okay, so with endometriosis, doctors may say, okay, let's do a scan or ultrasound. Now, when they do that, sometimes they can be looking for something called adhesions or lesions where the endometriosis causes something like webs to occur. So imagine like a spider web, and let's say we're gonna picture our uterus. Our uterus is in the middle, and we have our two fallopian tubes with our ovaries. Now, in our pelvic region, where endometriosis is usually located, we have our bladder, we have our bowel, um, and other structures are in that region. Now, maybe your ovary is missing. Let's say your right ovary is missing on the ultrasound. So the doctor may say to himself, okay, that's a bit strange. You never had surgery before to remove your ovary, right? And you say no. So then they may think, okay, the endometriosis probably has your ovary stuck to some other part inside of your pelvic region. Now, a scan is not the best way to diagnose endometriosis. A doctor may question, but they cannot for sure say, okay, it's endometriosis. The gold standard for diagnosing endometriosis is that laparoscopic surgery, where they insert different tools into your stomach. So they give you about four slits depending on the surgeon, I guess, depending too on the severity that they may be thinking about. They would cut you with some small slits in your stomach, and they would go in, inflate your stomach so that your organs are separated, so that they have that clear view of your insides. And then when they go in and they may see some red spots, because endo can present itself as some very red spots inside of your pelvic cavity. They would take that out, they would excise it, take that out, and they go and they send it to the lab. Now, that pathology report that you get back would tell you, okay, yes, it's endo, or no, it's not endometriosis. So the scans can give an idea, but it cannot say for sure that that is what it is.
Okay, and at what stage would you say they will perform the laparoscopy surgery?
The laparoscopic surgery.
Yeah, at
Um,
what stage?
I don't particularly think there's a specific stage. I think it would depend on the person, right? Because as I said previously, there's some people who don't want surgery, right? They rather just live with it, and they don't want that whole thing of going under the knife. Then there's some persons who may not be able to afford it, because these surgeries tend to be very, very expensive. I would say though that once doctors are thinking, okay, this may be endometriosis, they would go through all of the other options first. So before I cut you, let me try pain medication. Let me try the hormonal therapy. Let's see if you change your lifestyle, if that will help. And if those things tend to help, which it does sometimes for some persons, they no longer decide to do that surgery.
Okay, so for those persons that would have had to go through the laparoscopy surgery, would you then say that that can contribute to infertility? Is that in any way, could it possibly, cause infertility in a person?
You're saying the surgery itself, if it causes infertility for persons?
Yes, for those persons who may have endometriosis, and they're not quite sure as to whether they can, if they want to go through with the surgery, because they're thinking, oh, if I go through the surgery, then maybe later in life I won't be able to have children. So now, as a professional, I would say, would you then say that going through that surgery can potentially cause infertility in a person with endometriosis?
Personally, I would not say that. I how to put it? Everybody has to know for themselves, and this is why we say you speak to your medical practitioner, your doctor, your OBGYN, preferably your OBGYN. If you don't have one, you need to see one, especially if you think that something may be wrong. And you talk to them and ask them the risks, because there are risks when you are going under the knife. And I don't think that infertility or having issues with getting children is one of those risks. From my own personal experience, that is not something that I would have been told by medical doctors. They may say, okay, if the endometriosis is on your bladder, maybe we cut it too far and damage the bladder. Um, some persons do have issues with um, becoming pregnant, and this may be because of the endometriosis. And let's say maybe the endometriosis affects your ovaries to the point that the doctor says, okay, it makes no sense keeping the ovary. The ovary is totally damaged. In that case, then that when they have to remove your ovary or ovaries, then we obviously know, okay, you may not be able to get pregnant. The natural way, maybe you can have the IVF, right? And this is where fertility specialists come in, right? So you and your doctor may have to have a conversation with that fertility specialist to see the options that are there for you. Because if you don't have your ovaries, no egg is going to be produced, right? So then, do I get a donor? Do I get a donor egg and put it with my partner's sperm? What do I do in that case? So that is a conversation that persons would need to have with their doctor. As I said, OBGYN preferably, to see what can happen.
Would you then say that this can lead to other issues such as cervical cancer, um, probably fibroids and stuff like that?
Okay, so fibroids is a whole other condition. So there's no link that says, okay, if you have endo, you're going to end up with fibroids. But what I can say is based on research that has been done, there is a level of there's a risk for some women who have endometriosis. They may end up with ovarian cancer, right? There's no direct link stating, okay, if you have endo, you're going to end up with cancer, but they're realizing that there is a percentage of women who have endometriosis that end up having ovarian cancer. And for other, as I said, there are issues that can arise when you have surgery, right? Um, Endometriosis is a condition that can affect many different parts of your body, right? So the most common places for that to occur is within on your ovaries, your fallopian tubes, the ligaments that support your uterus, your intestines, your bladder, the peritoneum, which is the lining of your pelvic cavity. It can also affect the outside surface of your uterus. But then there are the less common places that it can go, like the skin, the eyes, the spine, the lungs, and the brain. Now we know that if this tissue goes into your lungs, for example, um, you're gonna have that buildup of that tissue and that breaking down, which then causes blood, and it can cause an inflammatory response. So then that causes lung issues. There's some women that cough up blood when they have their periods because maybe that is on their lungs, growing on their lungs. If it goes to the brain, if we're bleeding in our brain, that's going to cause an issue, right? So there are many other things that it can cause, but there is no certainty that if you have endo, that is going to be your situation.
Okay, and I know that the organization within itself also addresses the issue of PCOS. would you then say that there's some linkage between endo and PCOS? Just to draw a differentiation for persons who, throughout the conversation, are still thinking about PCOS?
Okay, so PCOS is an endocrine disorder, right? And when we say endocrine, we are talking about our hormonal system. So with PCOS, you may see persons being a bit overweight. You may see persons with a beard. You may see persons with acne. Persons may also have polycystic ovaries, hence the whole name polycystic ovarian syndrome. So when your doctor does a scan, let's say ultrasound, and they see these follicles on your ovaries, it could be one ovary, it could be both. So imagine a chain of pearls, and you ball that up into a ball. It would look similar to that on an ultrasound. And then the doctor may say to you, okay, let's do a blood test. Let's check to see if those hormones are out of whack, if your testosterone levels are higher than they should. There are also women who have higher levels of prolactin, which is a hormone in your body that allows your body to produce milk, right, when you're pregnant. So the levels of that hormone in your body increases when you're pregnant. But some persons with PCOS, they tend to have that increased level of prolactin even though they're not pregnant. So the doctor may then say, okay, we're going to try to see how we can decrease that so that you're not lactating, because some persons actually lactate even though they're not pregnant. Is there a link? I wouldn't say there's a link. I don't think that there's any research saying that there's a link between endo and PCOS. Endometriosis is a condition that doctors cannot understand why it happens. There's no cure for it. Um, and doctors are only going based on theories. So at one point, they thought that endometriosis was a working woman disease, meaning that persons who were older, right? Persons that were waiting, okay, let me get my job, let me get my house, let me get all of that sorted out first before deciding to have children. They were saying that that was most common in women of an older age. But now they're realizing that they're teenagers who have endometriosis, who show symptoms of endometriosis, right? And there are four stages. Let's just say this for our viewers. There are four stages of endometriosis that persons that they categorize it into. So there's the first stage, which is the minimal stage. Then there's the mild stage, the moderate stage, and the severe stage. Now, even though there are these four stages, the amount of pain that a person may have, it does not correspond with the stage. So because I have severe endometriosis, it doesn't mean that I have more pain than somebody who has, let's say, moderate or mild, right? What this categorization does is basically tell persons or tell doctors where the endometrial tissue is located specifically, or the amount, right? So the amount plus where it may be located inside of a person's body. You're with me, Iman?
Yes, I'm with you. And so, my final question then, is there a specific place in which persons can go then to, just do a checkup to see whether or not, well, now that they have some understanding of what endo is, to
Mhm.
go and check up and make sure that, I am able to treat it properly? Because there are girls who would
Mhm.
say that I'm having, a very bad period pain, and I've been experiencing this
Mhm.
for a long time, and I was just taking Panadols,
Yes.
or they were taking something else, and so they were just self treating the pains instead of going and see a gynecologist. So is there any place in Barbados where a person can go to be tested for it?
Well, not really tested, but what I would say is you find who is best for you. My personal experience, there's a place called there are many different gynecologists. There's Map Medical, there's GRB Medical, Even at the hospital, there are gynecologists there who deal with persons living with endometriosis. So persons would need to find who best suit them. And this is a topic that we would have discussed earlier this year in a youth chat that we had, the informed choice, right? Now, we know we may go to one doctor and we may not necessarily feel comfortable with what they're telling us. We may say, okay, but this person is not really listening to me. This person is not really understanding what I'm telling them. Should I keep going to this person? And what I always tend to tell people is that if you go to Dr. A and Dr. A, you're not really comfortable with what they're telling you, try Dr. B. If you're still not comfortable, try Dr. C. And if you have to go all the way down to Dr. F, H, or Z, you have that choice. That is your choice because you need to be comfortable with who you have as your medical provider. You need to feel as though you're being heard. You need to feel as though you are being taken on seriously because what women with this condition tend to realize is that and it's not just in the medical part, it's in society as well. We tend to play this hush hush kind of thing when it comes to menstruation. And we always assume, okay, your period, your business. Nobody has to know what is going on with you. That's a personal issue. Now, there are women who cannot talk to their families because nobody understands. People trivialize what they're going through. They say, okay, just go and lay down or go and drink a cup of tea. As we know in the Caribbean, tea helps everything apparently. But slowly we're getting the information out there to the society for persons to understand that this is not just a period, right? This is not just a bad period. This is not a stomach ache. This is not just something that you can brush off. This is something that causes serious issues. There are women who lose their jobs. There are women who lose relationships because of a condition such as endometriosis. This is a condition that is very debilitating, and this is why we need to not normalize debilitating period pains. Because if you are unable to go to work, you're unable to go to school, you're unable to function as a human being, it's not normal, right? It's not normal at all. And we need to find a way to get out of that habit. And I'm very glad that you guys invited us here to speak on this because this is something that because a lot of us within the organization, we have gone through serious issues with endometriosis or PCOS or fibroids, and having a voice, being on platforms such as this, we can spread that information to the society for persons to understand, you know what, there's a time for change and this is the time right now.
I totally agree with you because I can attest to having some bad period cramps now and then
Mhm.
having to go to school, and then I'm not sure for me, but the Caribbean country that I grew up in, mommy used to always say take a little shot of gin or something so, and it will wash the pain away. But then sometimes it does not help, and then
Yeah,
sometimes you know persons would always say you're being too dramatic, or you need to just go in the corner, lie down 5 minutes, it will weigh itself out. But then
yeah,
how then are we supposed to encourage girls who are actually suffering from it and do not know what to do?
yes. That That's a very important point, and this is where talking to our young women, so mothers, we need to talk to our daughters, and we even need to talk to our sons because I find in society, I don't know if this is just a natural thing that men do, but we always hear, "Why you getting all like that? You put your period." Don't say things like that because you're not understanding that this is a condition that some women cannot get out of bed. Literally, your body is fighting you from the inside, and you are fighting on the outside, trying to survive, trying to do what you need to do as a woman. And persons are thinking that it's just, as you said, you're being dramatic. There are women who have to be hospitalized. And you would think for a period, you gotta get hospitalized for a period. Yes, these are serious matters that we as women are dealing with. And just to put a very important point, because you're having bad periods, it doesn't necessarily mean that you have endometriosis, right? But if you know that you're not functioning as a normal human being, we always say go and get that checked because it just might be something. It may not be endo, it may be something else, right? It could be something other than it could be PCOS, it could be um, adenomyosis, fibroids, it could be something like that. There are women who walk around in society and you may see them with a big tummy, right? Persons with endometriosis tend to have something called endo belly, and you look pregnant. And people come and they say, oh, yeah, expecting, congratulations. And it's like, no, right? So as a society, we need to be more sensitive to women. I would say we need to educate our young men, we need to educate our boys about these things that women go through because at the end of the day, they're going to have wives, they're going to have daughters, they may have sisters, aunts, grandmothers, and they need to be able to be that support because you need a support system when you're going through a condition such as this. And what research has shown and what doctors would have realized is that women with these kinds of conditions tend to develop things like depression and anxiety, right? And imagine just dealing with this. Your body is doing all of these different things. Some people can't eat, some people can't keep down food, some people can't sleep, they have bad headaches, that pain with intercourse. Imagine a relationship. You're having this pain with intercourse. You don't want to do anything with your partner because you know that it's going to be painful. It's not an enjoyable thing for you. That in itself can put you into a very bad mental state. Um, Persons can, there's so many different things that can occur with endometriosis, and it's not easy to deal with. So we can understand then why a person may have anxiety. So you're accustomed to bleeding very heavily and you're going to work and you're always, anxious to see, okay, am I bleeding out? Can anybody see that there's blood on my skirt or something? You're always uneasy, right? Having to change your pad so regular. Suppose you forget to change the pad. Maybe you're having a conversation or you're stuck doing something at work and you forget to change your pad and all of a sudden this you stand and just have this whoosh of blood, right? That in itself can cause you to develop mental issues such as depression and anxiety. So there's a whole realm of things that surround a condition like this, and this is not a condition that we can just get rid of, right? Some things people say, oh, you're going to grow out of that. This is not something that you grow out of. This is something that's lifelong. This is something that doctors have no cure for, right? So even after you have surgery, right, there's that chance of endo reoccurring, right? Um, so I'm so happy that you guys decided to have. I think we're gonna have another session where we probably go a bit more into it, and maybe we can have another endo warrior because we call ourselves endo warriors, and they're PCOS sisters, right? Um, Maybe this is something that we can have many different persons on for this talk.
Definitely, definitely. And one final question before you go. You said that there is no age time to it. And now somebody wants to know, after a person would have gone through that stage of having their menstrual cycle and stuff like that, um are they still affected by endo? And I'm talking about 54, 50, 55. You know, that age of when you're no longer seeing a period. Can a person then still be affected by it?
Well, there are persons that are in that age range that would tell you yes, they have still experienced issues with that because there are people who, let's say, they have a hysterectomy, right? If you have a hysterectomy, you get rid of your uterus. If you have a full hysterectomy, you get rid of everything. But if that condition, if that endometrial tissue is on your pelvic wall, it's on your bladder, it's on your um, what you call it, let's say bowel or rectum, your body will still produce a hormone, the hormone that doctors see affecting endometriosis and making it increase. Your body may not have the same level, of hormone being produced, but you're still gonna have some level of that hormone being produced. And I guess this is where women will say, I finish having periods, but I still get pain, right? So then they would then go to a OBGYN and say, okay, I finished having a period. Why am I still experiencing pain? So there are women who have said, and I've heard it from them saying, yes, after I was finished seeing my period, I was still having issues. And that may not be for everybody. Let's remember that it may not occur for every single person, but there's some persons who that happens to them.
Okay, so definitely after a period, during your youth, even after menopause, you can still experience some level of pain, correct?
Yes, please.
Okay, thank you so much, Miss Warden, for joining us.
No.
I do want to thank our viewers for joining in, and for those of you that would have sent in your questions, thank you so much. Please continue to follow us on Instagram, Twitter, and Facebook. Our YouTube channel is up and running, and remember to stay engaged with us throughout the rest of the year. Our next session will be coming up very soon, and I can't wait to see you guys in the next one. I've been your host, Miss Iman Wilson, first floor member of the Barbados Youth Development Council, and with me I had in studio tonight was Miss Shante Warden of the Barbados Association of Endometriosis and PCOS.
Good night, everyone. Thank you for being here.